Hello, my name is Heather Husbands, and I'm doing my presentation on cystic fibrosis. Cystic fibrosis is an autosomal recessive disease, which means that two copies of an abnormal gene must be present in order for the trait to develop. Cystic fibrosis is a progressive, genetic, multi-organ disease that causes persistent lung infection and difficulty breathing for the individual. Cystic fibrosis is a defect in the gene that regulates the movement of salt and chlorine in and out of the cell. There is a decreased secretion of chlorine, and this causes thick mucus to form. It is a mutation in chromosome 7, which is cystic fibrosis transmembrane regulator, CFTR. This gene helps distribute chloride through the channels. Individuals who get cystic fibrosis are more likely to get them when the family has them, so either of the parents, and this is why it's called a family history disease. Since cystic fibrosis is recessive, like I said earlier, both parents have to be carriers in order for the child to even have a chance of getting it. Each child born to parents who are both cystic fibrosis carriers has only 1 in 4 chance of having the disease. And cystic fibrosis occurs most commonly in Caucasians. More than 10 million Americans in the U.S. are carriers of this faulty cystic fibrosis gene. And if an individual does have this gene and cystic fibrosis, it can lead to bronchitis and things like chronic infections, coughing up blood, respiratory failure, and more. Signs and symptoms of cystic fibrosis is very salty tasting skin, persistent coughing and sometimes phlegm, frequent lung infections including pneumonia or bronchitis, wheezing or shortness of breath, poor growth or weight gain in spite of good appetite, frequent greasy, bulky stools or difficulty with bowel movements, and in males, infertility. Mostly, cystic fibrosis occurs in the United States, and like I said before, it can be found in Caucasians the most, but also Indians and Latinos. To test for cystic fibrosis, a blood test occurs. In addition, 2 sweat tests on 2 different days will determine if an individual has cystic fibrosis. The sweat test determines the amount of salt that is on the person and can tell if they have it by placing medicine on there and collecting all the sweat. If the genetic test detects 2 defective cystic fibrosis genes, then just 1 sweat test result will be necessary to confirm that there is. Treatment for cystic fibrosis is not a thing. If an individual does have cystic fibrosis, then there is actually no cure. But treatment can ease symptoms and reduce complications. Close monitoring and early aggressive intervention is recommended for the individual. Managing cystic fibrosis is very complex, so it is recommended that the person stays in a center staffed by doctors so the doctors can help take care of the individual. The goals of treatment include preventing and controlling infections that occur in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and providing adequate nutrition. If an individual does have cystic fibrosis, they can also take medication to help with lung infections and abilities to help provide them with a better life and keep things easier for them. And here's my references. Thank you.